Hello, how's everybody doing? Back again, it's Dr. Coring coming from you again live. Basically, would like to discuss folate deficiency today. And just for people who do not know who I am, again, my name is Dr. Coring. I'm an internal medicine physician as well as a pharmacist by training and trade. I'm also currently in a fellowship learning how to be a hematologist oncologist. And so, what I like to do, what is actually my passion, is to educate common folks, people, patients, what have you, just about diseases, common things that I see and treat pretty much on a daily basis. Today, I want to talk about folate deficiency, which is also a very common disease. I would like to discuss what it is, why is folate important. We'd like to discuss the symptoms of folate deficiency. What are the risk factors of folate deficiency? What are the complications for this disease? How do we treat it? And lastly, how do we prevent it? And so let's get started. It's always my goal to do these videos, these discussions, these talks in 10 minutes. I respect you guys' time. My time is valuable. Your time is valuable. And so I want you to learn. 10 minutes, learn this disease, understand everything I'm going to discuss, and be able to understand the signs and symptoms and know when to get treated, how to get treated. So let's get into it. So what is folate deficiency? So let's first talk about folate. What is folate? Folate is a B vitamin. It's a vitamin that your body don't produce. We have to get it from an outside source. Mainly, we get this vitamin through foods. And so I will discuss later on, the different foods that are rich in folate that we get this B vitamin from. But it is a B vitamin. And so what is folate deficiency? And just in the term, it's just a disease that happens when you are depleted of this B vitamin called folate. And so why is folate important? Why do we need it? Well, it turns out that this B vitamin is very instrumental in producing red blood cells. It also helps with the DNA or producing and manufacturing the DNA of other cells as well. And so it tends to cause anemia, basically reduced amount of red blood cells when we are folate deficient or when we have a lack of this B vitamin. And so that brings me to the symptoms. So what are the symptoms of folate deficiency? Well, if this disease, lack of B vitamins, causes you to be anemic, then your symptoms will be centered around anemia. However, this B vitamin also plays a role in neurological function as well. And so it can also cause neurological malfunctioning. And let's get more specific. So let's talk about the symptoms of anemia. So as I mentioned, this B vitamin, specifically B9, folate, is instrumental in producing red blood cells. So if you don't have folate, you're not going to have a lot of red blood cells, and therefore you're going to be anemic. And what are the symptoms of anemia? Fatigue, weakness, is the main symptom. Lack of energy, shortness of breath. So you have all of that. But also, lack of folate can also cause someone to have neurological deficiencies or neurological problems. And so we talked about the weakness, memory loss, lack of concentration, confusion, muscle weakness also can happen with folate deficiency. And so what are the risk factors? What are the risk factors of folate deficiency? Let's get into that. And so one of the primary risk factors is nutrition. Just basically not eating the foods that are rich in folate. And so that's a major risk factor, is just basically not eating the foods. And also losing a good amount of folate also is a risk factor as well. Malabsorption is a risk factor of folate deficiency. Folate is actually absorbed in the gut. Similar to iron, we talked about iron, it's absorbed in the gastrointestinal tract. B12 also absorbed in the gastrointestinal tract. So folate's the same thing. This vitamin is absorbed in the gastrointestinal tract as well. And so if you have a problem with absorption, anything that could affect absorption in the gastrointestinal tract, can also cause folate deficiency. So that put you at risk. Um, Also, drugs, medications like methotrexate, uh, Bactrim, or this medication, antibiotic called Bactrim, or sulfamethoxazole, trimethoprim. It's a combination medication called Bactrim. It's an antibiotic. We use it to treat various amount of infections, commonly urinary tract infections, that can cause folate deficiency. Why? Because it uses folate to actually convert or to be metabolized. Methotrexate, the same. Phenytoin, also an old drug to treat seizures, can also cause folate deficiency. And also increased requirements. And what does that mean? And so anything in our body that will allow our body to need more folate. So what am I saying? What I'm saying is we need folate to manufacture red blood cells. And if our body is at a state where we're using red blood cells at an increased amount, then our body is going to be trying to manufacture red blood cells to replenish what we're losing. So what are these conditions? Losing blood, hemolysis. And that's a fancy way of saying that your red blood cells are being broken down. Maybe they're being broken down because of a disease. Maybe they're being broken down because you have maybe a cancer. So any chronic condition where your blood cells are being broken down continuously will put you at risk for folate deficiency. One common disease that I could think of is sickle cell anemia. This is a disease where your blood cells are chronically, continuously being broken down, and your body is continuously trying to replete or replenish these red blood cells that are being broken down. And so, therefore, your body is going to be asking and trying to ask and produce, manufacture more folate. And if you're not eating the proper foods to replenish, then your body is going to be at a deficit. And so, sickle cell anemia is one. Pregnancy. Oh my God, pregnancy is one of the main things. Why? Is because the infant is requiring so much folate. The infant needs folate in order to grow and be healthy and develop neurological functioning primarily. So the infant neurological system is developing. And so therefore we OBGYNs, primary care doctors, always asking pregnant women, are you taking your multivitamin? Are you taking your folic acid? That's part of the prenatal regimen. Why? It's because the woman will easily become folate deficient because the baby is requiring so much folate from the woman because the baby is growing itself. And so we oftentimes prescribe. Now, what happens when a woman don't get enough folate? Well, the baby suffer. The neurological development of that baby suffers. And so it put the baby at risk for spina bifida. And so folate is very important for our pregnant population. And so to summarize, the risk factors and major risk factors for folate deficiency is nutritional deficiency, malabsorption, medications, and increased requirements. The nutritional deficiencies are very important. I want to talk about that just a little bit. So people who abuse alcohol, they typically become malnourished because they always thinking about alcohol instead of actually food. And so that makes them malnourished and they don't eat the necessary foods that would help them with their folic acid deficiency. Also, if you just malnourish yourself, if you're anorexic, if you don't eat a large amount of food. And then let's talk about the specific foods. So green leafy vegetables and basically cereals. And so here in the United States, what we do is we fortify our cereals to prevent folate deficiency because I think the government knows that most people don't eat the green leafy vegetables because that's the product, that's the food that the folate, this B9 vitamin, is in. And so I think because the government knows that, they just fortify the cereals that we feed our kids pretty much every morning. And, these cereals, these grains, it's already fortified. Breads, most dry food, cereals already have enough of the folate in it. The daily requirement is just 0.4 milligrams per day. And our foods already have that in it with natural fortification. And so those are the risk factors. We talked about that in great detail Now, what's the complications? What happens if somebody is folate deficient? Well, they become anemic. We talked about that. And in the setting of their anemia, they have symptoms. And we talked about that. Also, they put you at risk for Alzheimer's because of the confusion. It put you at risk for depression, low energy. It put you at risk for dementia, weakness. And so there's some serious complications. And the most dramatic complication is our pregnant women, our infants, our neonates. That's why, again, I can't emphasize this enough. If you're pregnant, you need folic acid. You need to take a B vitamin. You need the B9 complex, the B9 or the folic acid or a B complex or just a prenatal vitamin. That's one of the take-home messages here. And so how do we treat this? We basically give you the supplement. We easily give up to 5 milligrams of folic acid a day as the maximum dose. Over the counter is 0.4 milligrams. Prescription is 1 to 5 milligrams. You take it every day. You start feeling better within a matter of a month. Within a matter of 4 weeks, you will notice your blood counts are improving. You have more energy. You have more concentration. And yeah, you're hitting on all cylinders just by taking over-the-counter B vitamin. And you can also eat foods that have the folic acid. Like I mentioned, the green leafy vegetables. We all need more green leafy vegetables. The one thing, though, I want to warn you guys about is overcooking fruits and vegetables. Because what I'm saying and what I'm suggesting is that the folic acid is located in the green leafy vegetables. But if you cook the vegetables, then you get rid of the actual folic acid. So what I'm trying to say and what I'm suggesting is stop searing your collard greens. I mean, we cooked the hell out of collard greens. I remember growing up, my mom, she'll cook the collard greens basically till all we had was the hog maw and the rice with a little bit of the collard greens. So what I'm trying to say, eat the vegetables raw. Eat them raw. That's how you get the nutrients. And if you want to cook your collard greens, have a batch of cooked collard greens, but have a batch of raw spinach, so you could get your nutrients. Because when we cook these collard greens and we cook the cabbage and we sear it basically to the point where we don't have any nutrients. And so all we're eating is seasoning. And that raises our blood pressure. All right, guys, that's my time. We talked about folate deficiency. I talked about what it is, why folic acid is important, what are the symptoms of folic acid deficiency, what are the risk factors. I talked about complications, how do we treat it, and how do we prevent it. Just eat your vitamins. Eat your vitamins. Everybody should be on a multivitamin. Eat green leafy vegetables if you can. And if you're pregnant, definitely you should be on a B vitamin complex. Prenatal vitamins are enough for sure. All right, guys. I love you guys. Peace and love. This is my time. See you.